Bismillahirrahmanirrahim. The topic of discussion today is the muscles of the hand. I am Dr. Sahar Tasneem and I am going to give you a brief view about the muscles of the hand. First of all, we should know that what are the compartments in the hand where the muscles lie. As we all know that the muscles of the hand are present or located in five compartments: thenar muscles, hypothenar muscles, pollicis muscles, short muscles of the hand, and these short muscles consist of lumbricals and introshi. So you can see here that the thenar muscles form the thenar eminence on the lateral surface of the palm, and they are chiefly responsible for opposition of the thumb. This is basically the thenar compartment where the thenar muscles are present. Here you can see that this muscle is the abductor pollicis brevis. Okay, this one which you can see here, abductor pollicis brevis. Just lateral to that is the flexor pollicis brevis. Okay, this is adductor pollicis brevis, this is flexor pollicis brevis, and the third muscle which lies in this compartment is the opponens pollicis, which lies deep to the adductor and flexor pollicis brevis. Once we will cut this muscle, we can see the location of the opponens pollicis. Just lateral to that is the adductor compartment, and here the adductor pollicis lies. You can see here this is small muscles. This is the adductor pollicis. We will study about it one by one again. Okay, just opposite to the thenar, there is a hypothenar compartment. These are the muscles that are present in the hypothenar compartment. These consist of abductor digiti minimi, flexor digiti minimi, and opponens digiti minimi. This one is the abductor digiti minimi. The flexor digiti minimi and the opponens digiti minimi lies below that. So these are the three compartments which you can see here. Just deeper to the central compartment in the hand, there are short muscles of hand which are called as lumbricals. Okay, and the introshi are present in the deeper compartment or separate introitious compartment between the metacarpals. Okay, they lie between the metacarpals, which are called as introshi. Now the thenar muscles. One by one we will study about each of the muscles. The thenar muscles form the thenar eminence, and movement of the thumb is important for precise activities of the hand. Here you can see in this movement, this is basically movement or opposition of the thumb. You should memorize that this opposition of the thumb is caused by these thenar muscles, mainly the opponens pollicis. Okay, the opponens pollicis is a muscle which causes the opposition of the thumb. Here you can see that this is the opponens pollicis. We got this muscles once we cut the abductor pollicis brevis muscle. This is the abductor pollicis. We remove that muscle, and just below that there is a opponens pollicis. This one is the flexor pollicis brevis. These are the three muscles, 1, 2 and 3. These three muscles are mainly present in the thenar compartment. Again, we have to study about their origin, insertion, nerve supply, and their action. Now, what is the origin of thenar muscles? This is very easy to memorize the origin or proximal attachment of the thenar muscles, that you can see here that they are coming from the same or common origin, that is flexor retinaculum and tubercles of the scaphoid and trapezium. Here you can see these are the three muscles. Okay, the abductor pollicis brevis, flexor pollicis brevis, and just below that is the opponens pollicis. They all are coming towards the flexor retinaculum and tubercles of scaphoid and trapezium. They are originating, but the insertion is slightly different. The abductor pollicis brevis and the flexor pollicis brevis, they are attaches on the lateral side of base of the proximal phalanx of thumb. Okay, but the opponens pollicis, which lies below that, it is basically attaches over the lateral side of first metacarpal. So they are all the muscles. The flexor pollicis brevis has a superficial head and the deep head. So Here you can see that these are the three muscles. The abductor pollicis brevis. This is a short abductor of thumb. We remember the abductor pollicis brevis is a short abductor of thumb. It forms the anterolateral part of the thenar eminence. In addition to abducting the thumb, it also assists in opponent's pollicis during the earliest stages of opposition. I have showed you the slide before that where there was the opposition of thumbs was showing. So that is the abductor pollicis brevis, which was assisting the opponent's pollicis. To test the abductor pollicis brevis, you can abduct the thumb against resistance, and if it is acting normally, the muscle can be seen and palpated. Okay. So the next muscle is the flexor pollicis brevis. So the flexor pollicis brevis is the short flexor of the thumb and is located medial to the abductor pollicis brevis. Okay, it just lies medial to that. The two bellies on opposite side of the tendon of flexor pollicis longus. Okay, and this is the muscle which sometimes contain the sesamoid bones. Okay, the bellies usually differ in their innervation. The large superficial head of the flexor pollicis brevis is innervated by the recurrent branch of median nerve, whereas a smaller, deeper head is usually innervated by the deep branch of ulnar nerve. Okay, here you can see that this is the blood supply of a recurrent branch of median nerve. This is all supplied to the uh, opponent's pollicis, abductor pollicis, flexor pollicis, superficial head. Okay, but this deep head is not supplied by this nerve. Okay, the deep head of the flexor pollicis brevis, this is supplied by the ulnar nerve. Okay, because here the ulnar nerve branches go on to other side. Okay, this was about the thenar muscles. The last muscle is the opponent's pollicis. I have showed that movement. The opponent's pollicis is a quadrangular muscle that lies deep to the abductor pollicis brevis. Okay, it lies deep to that, and it flexes and rotates the first metacarpal joint medially at the carpometacarpal joint, which I have showed you. That movement occurs when picking up an object. Okay, during the opposition, the tip of the thumb is brought in contact with the pulp. I have shown you in the diagram that they both come together and this will cause the opposition of the thumb. This was about the thenar muscles. Now, the second compartment was the adductor compartment. I have told you that the adductor pollicis is located in the adductor compartment of the hand and is a fan-shaped muscle that has two heads in origin, which are separated by the radial artery as it enters the palm to form the deep palmar arch. Here you can see here, this is the radial artery. It is entering in the arm, and this is the muscle that is the adductor pollicis. Okay, it has fan-shaped muscles you can see here, and it is basically the tendons usually contain the sesamoid bone. Okay, the adductor pollicis adducts the thumb, moving the thumb. Okay, this is the adductor pollicis which has two heads. The one is the oblique head and one is the transverse head. The oblique head comes from the basis of second and third metacarpals, capitate and adjacent carpals. Okay, you can see here that this is the oblique head that is coming from the basis of the second and third metacarpals, and where it is attaches on the medial side or base of proximal phalanx. Okay, then the transverse head coming from the anterior surface of shaft of third metacarpal, and it is also attaches on the medial side or base of proximal phalanx of thumb. These all muscles are supplied by deep branch of ulnar nerve, and they all combine together forming the adduction of the thumb towards the lateral border of the palm. This is the adductor pollicis muscle. Now coming towards the hypothenar muscles. The hypothenar muscles produce the hypothenar eminence on the medial side of the palm and move the little finger. Okay, these muscles are in the hypothenar compartment with the fifth metacarpal. The attachments are, you can see here that they are muscle abductor digiti minimi, that is the most superficial of the three muscles forming the hypothenar eminence. Okay, you can see this is the view of the hand where the hypothenar muscle is present. So the first muscle in that is the abductor digiti minimi. Abductor digiti minimi comes from the pisiform bone and is attached on the medial side or base of proximal phalanx of the fifth digit. In the next slide, I will explain you that the flexor digiti minimi brevis and opponent's digiti minimi. These are the two muscles that are having the common origin. The flexor digiti minimi brevis is variable in size and it lies lateral to the abductor digiti minimi. The flexor digiti minimi brevis flexes the proximal phalanx of the fifth finger at the metacarpophalangeal joint. The opponens digiti minimi, this is a quadrangular muscle and it lies deep to the abductor and flexor muscles of the fifth finger. Okay. This is the basically all of these flexor digiti minimi brevis and opponens digiti minimi. They have a common origin from the hook of hamate and flexor retinaculum, and they are all attaches over the medial border of fifth metacarpal. This opponens digiti minimi, okay, and they all are supplied by D branch of ulnar nerve. And this opponens digiti minimi cross the fifth metacarpal anterior and rotates it, bringing the fifth digit into opposition of the thumb. This was the muscular attachments on innervation actions of the hypothenar muscles. In after that, I'm just going to explain you the palmaris brevis muscle. This is a very small muscle. Here you can see in this slide. Just I have repeating the slide again to show you the what we have covered up till now. This is the hypothenar eminence or hypothenar muscles that consist of abductor digiti minimi, this one flexor digiti minimi, and then opponens digiti minimi. These are the three muscles that are involved in forming the hypothenar eminence. And this one is the ulnar artery that is coming from here, and these are the muscles in the hypothenar compartment. These are again the present in the thenar compartment. This abductor pollicis brevis, flexor pollicis brevis, and in just below that is the third one, that is opponens pollicis. This is opponens pollicis, abductor pollicis brevis, and the flexor pollicis brevis. This is thenar compartment, this is hypothenar compartment. Now we are going towards the central compartment. So what is present in the central compartment? The short muscles of the hand. The short muscles of the hand are the lumbricals and interossei. Okay, before going to tell you about the lumbricals and interossei, I am going to tell you about a small muscle that is the palmaris brevis, which is a small thin muscle in the subcutaneous tissue of the hypothenar eminence. If somebody asks from you in the viva, either if this this muscle is not that much important, but I'm just going to give you a small view that is the palmaris brevis is the muscle that is subcutaneous that is coming from the subcutaneous tissue of the hypothenar eminence. Okay, it is not the hypothenar in the hypothenar compartment. Okay, but the main function of palmaris brevis is that wrinkles the skin of the hypothenar eminence and deepens the hollow of the palm. Okay, so in gripping of the palm, is this muscle is important. Palmaris brevis covers and protects the ulnar nerve and the artery, and it is attached proximally to the medial border of palmar aponeurosis and to the skin on the medial border of the hand. Now I'm going to tell you about the lumbricals muscles. The lumbricals are four in number, the four slender lumbrical muscles. They are named lumbricals. Why? Because of their worm-like appearance. Okay, you can see here in these are lumbricals. Okay, 1 2 3 4. Okay, they are worm-like, looks like a worm. The lumbricals flex the fingers at the metacarpophalangeal joints and extend the interphalangeal joints. Okay, this is first and second lumbrical that are coming from the lateral two tendons of the flexor digitorum profundus. Okay, and the third and fourth lumbrical coming from medial three tendons of the flexor digitorum profundus. All of these are inserted to the lateral side of extensor expansion. Okay, lateral side of extensor expansion of second to fifth digit. Okay, second to fifth digit. They are the first and second lumbrical as they lie here, so they are supplied by median nerve. And third and fourth lumbrical, they are supplied by deep branch of ulnar nerve. What are the function of all of these lumbrical is to flex metacarpophalangeal joints, extend interphalangeal joints of the second to fifth digits. This was about the lumbrical muscles. Now you can see here, this is the movement, small video. You can see here, this is the movement of the lumbricals, how they are moving the hand and how much important they are. You can see here again in this picture, this first and second lumbricals. These first and second lumbricals coming from the lateral two tendons of flexor digitorum profundus, and third, fourth lumbricals coming from the medial three tendons of the flexor digitorum profundus, 1, 2, and 3, because they are coming from both sides. Okay, and they all are attaches over the medial side. The all are attaches over the lateral side of extensor expansion of second to fifth digit. This, what is this? This is basically the flexion at metacarpopharyngeal joints and extension of the interpharyngeal joints of second to fifth digits. So this is the function of the lumbrical muscles. Now the last small muscles are the interossei muscles of the hands. The interossei are basically four in number. The first to four are basically dorsal interossei. First, second, third are the palmar interossei. So there are two types, dorsal interossei and palmar interossei. Now again same proximal attachment, distal attachment, innervation and main action. The proximal attachment of these muscles, you can see here, these are the palmar interossei and these are the dorsal interossei. You can see from the dorsum of the hand. Dorsal interossei are coming adjacent sides of the two metacarpals. You can see here. All of these are coming from the adjacent sides of two metacarpals. And where they are attaches? They attaches the bases of the proximal phalanges, extensor expansion of second to fourth digit. What are the nerve supply is the deep branch of the ulnar nerve, and the main action of the dorsal interossei is that it abducts second, third, fourth digits from axial line and act with umbilicals in flexing metacarpopharyngeal joints and extending interpharyngeal joint. Then the palmar interossei. Palmar interossei, you can see here that coming from the second, fourth, and fifth metacarpal. Okay, the interossei are very important because they causes abduction and adduction. Combinedly, they will cause abduction, adduction from second, third, fourth digits as well as second, fourth, and fifth digits towards the axial line. Okay, the four dorsal interossei muscles are located between the metacarpals, and the three palmar interossei muscles are on the palmar surface of metacarpals in the interosseous compartment of the hand. Be remember this thing, the first dorsal interossei muscle is easy to palpate. It opposes the thumb firmly against the index finger and it can be easily felt there. Okay, the four dorsal interossei abduct the fingers and the three palmar interossei adduct the fingers. Okay, you can make any mnemonic as in the books it was written that the dab is basically the mnemonic for these interossei. Dab means dorsal abduction and means the dorsal interossei causes abduction, and pad means palmar interossei causes adduction. So this is some simple mnemonic to memorize these. Okay. Understanding the Z movement is useful because it is opposite of the claw hand. Z movements can also occur in these muscles. So these are the dorsal interossei and these one are the palmar interossei, and they all are supplied by the deep branch of ulnar nerve. Here you can see in this diagram they will causes combinedly they will causes the abduction as well as adduction. So these are the function of the dorsal and palmar interossei. The dorsal interossei, you can see here, look, they are this dorsal interossei are coming from the adjacent sides of two metacarpals, and we remember these things, they are bipinnate muscles. Okay, the palmar interossei, these are the unipinnate muscles. Okay, they are bipinnate as they coming from both sides, and they are unipinnate muscles. Okay, these dorsal interossei attaches on the basis of the proximal phalanx, and these are attaches on the basis of the proximal phalanges, extensor expansion, second, fourth, and fifth digits, or they all are supplied by the deep branch of ulnar nerve. This is the action of the interossei muscles. Thank you so much. This was all about the short muscles of the hand. You have to memorize all of their proximal attachment, distal attachment, as well as their innervation and their action. The actions are very much important because these are all the intrinsic muscles of the hand, and they are important in many things, because you all know that the hand is the manual part of upper limb that lies distal to the forearm. Okay, you have covered all of the forearm. Now you have entered in the hand. So before going to deep discussion, you should memorize the muscles of the hand. The wrist is basically located at the junction of the forearm and the hand. Okay, So you should remember these things, that the palmar aspect of the hand features a central concavity. Okay, with the crease proximal to it separates two eminences. The lateral is larger and more prominent, that is called as thenar eminence, and at the base of the thumb, and a medial small hypothenar eminence that lies proximal to the base of fifth finger. So this was all about the muscles of the hand. Thank you.